Hi everyone, Dr. Farahani over at Harmony Dental Wellness. I'm here today to talk to you about the comparison between the iTero scanner and the Trios 3Shape scanner. Both of these are digital scanners that you can use for restorative work. You can use it for digital mock-ups, you can use it for removables, you can use them for orthodontics, you can use them for all sorts of things in your office. So I absolutely think having a digital scanner of some sort in your office is a game changer, and every office should have one. But the question is, which one do you buy? So here are a couple of the similarities and differences between them. Both of them have a wand. Now the first one I'm going to show you, this is the wireless wand from 3Shape. What I love about it, of course, is that you're unrestricted. You can move around the room. It comes in two different designs. This is the kind with the handle. They also make it without this piece so that it's a pen grip. And I really like the handle because this provides really good ergonomics. It has a single button right here, and the tip, which just slides off, is completely autoclavable, so you don't have to have an individual tip for each person. This tip head is really small. I really like the size and the maneuverability within the mouth. It's also really forgiving in terms of how close you have to be to the tooth. So I really like this wand better than the iTero wand, and I'll show you why. The iTero wand is big and bulky, and it's got a 6-foot wire on it, so you are really restricted to where you can be with this. This head, it's rubberized, so it's softer, but it also is bigger. And when you're back around those second molars, it's difficult to manipulate. You have to really get the patient to help you with closing and shifting their jaw. You get used to it. It's not that it's not doable, but it's definitely more cumbersome. Also, these tips, you have to have an individual tip for every single patient, and that gets pretty pricey. So we put the name on it, we keep them so we can reuse them for the individual patient. This is just the hold-in tip. It has buttons on the sides, here and here, and then it has a sort of touch pad on the top that you can use to manipulate what's going on the screen. Both of them have really easy interfaces that you can use through the handset, so you don't have to continually touch the screen. So those are the main differences between the handles. Now let's talk about the individual scanners. We're going to start over here. This is the 3Shape scanner. You'll notice it has just a laptop that comes with it, and this is a true color image. On the iTero, it's close, but it's not quite true color. You'll notice that when we go back and forth. And for comparison's sake, we're using my teeth for both of these. So here we go. As we go around, it shows me in blue the areas that I've missed capturing. And I can go up here and I can turn off individual arches and look at what's happening. I can zoom in, I can zoom out. And the resolution is always really good. I can also check with this little clearance button here exactly how close the teeth are to each other. That's really helpful when I'm doing crown preps to be able to check my clearance. And those blue spots are the points where the teeth are actually touching. And then the color gradient can be adjusted here. I can actually drag this up and down in order to change my scale. And so I really appreciate that as well. That's helpful when you're talking to people about problems with their occlusion, when we're doing, for example, TMJ work. It also has buttons that you can use if you have a prep to be able to show the lab the direction that you want that prep to go in. If you're working on a bridge, you can check it. And the other thing that I wanted to show you is you can switch this to a model mode. That gives you a little bit more eye for detail, and that comes in handy when you're using time-lapse. I'm going to go over time-lapse in a separate video, so if you want to learn about that, check out that other video. In terms of ease of use, when we're in scanning mode, you do one arch at a time, and it is really forgiving on which way you do. It has a nice interface over here, so if I decide that I want to do a case, I just pick the lab I want. You can use just about any lab that you darn well feel like it, and then you can pick what type of case you're doing for it. And it guides you through step by step what you need to do. All right, let's go over to the iTero. The iTero, as you can see, not quite true color, but it's really nice and slick, right? This is easy to wheel back and forth, and with this big touch screen, patients love to play with this. And one of the great things about this machine is that it really is great for patient engagement. It also has some really easy buttons on the side. I can just kind of touch and flip to some really helpful views. And just like the other one, I can go to model mode and I can look at time lapse. or any other details that I want. This is also really good for checking if my margin is clear for the lab. Then also, just like on the other one, I can look at the bite. I can turn off an arch just by simply touching, and voila, it shows me where my teeth are touching. And again, really helpful for being able to talk with patients about occlusion. If you've got an area of recession that you wanted to discuss and you want to talk about the forces on that, that's how you would do that. Now, the other big benefit of iTero is that it interfaces directly with Invisalign. So if you're in an office that does a lot of ortho, this is really, really valuable. It sends the scan directly to Align, and I'll go back to the menu for a minute. And within about 5 minutes usually, sometimes it's a little bit longer, but you can get this exact screen on any computer and you can manipulate it the exact same way. That's one of my big loves about this machine. So even though I'm not a big fan of the wand, I still really like it. And I can do things like the outcome simulator. If someone's in the middle of treatment, I can use that scan and it'll show me where it's supposed to be in conjunction with their ClinCheck. And if I'm just starting out with doing ortho, I can use the Invisalign Go simulator and assessment to tell me if it's a good case that I should consider or not. Comparing scans is really easy on this too, and we can look at that in that other video as well. I hope that helps you make your decision. These are just 2 of the scanners out there. There's a lot of them out there, but these are my 2 favorites, and I wish you well in all your endeavors. See you soon. Thanks. Bye.